Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. In today's video, I'm going to be discussing what is piriformis syndrome and how do you treat it. Piriformis syndrome is a condition where the sciatic nerve gets irritated where either it goes underneath or through the piriformis muscle. So the piriformis muscle gets tight and it compresses and irritates the sciatic nerve. And this can cause pain, tingling, numbness all the way down the leg. Now it'll mimic sciatica, but the difference is sciatica typically will involve lower back pain, whereas piriformis syndrome will typically be from the glute region and then down. And typically what you'll notice is when you're sitting on the nerve, that'll be a big irritant. You're driving, climbing up and down stairs, and those will be positions or movements that can irritate piriformis syndrome. So what we're going to do is we're going to demonstrate how you would treat it, and I'll show you some stretches you can do at home to relieve piriformis syndrome. So what we're going to do to treat piriformis syndrome is we're going to treat the irritated nerve, and then we're going to treat the tight muscle that's causing the piriformis syndrome. So typically what will happen is the nerve will get irritated or compressed. And if someone's dealing with a really painful piriformis syndrome, what we like to do is we like to calm the nerve down. And one of the ways we do that is with laser therapy. So what we're going to do is we're going to apply laser therapy over the nerve to calm it down and relieve the pain and inflammation. And what the laser therapy does is it penetrates deep around the nerve to help calm that nerve down and relieve the symptoms and the pain. This is a great anti-inflammatory treatment that we can do in the office to help calm that irritated nerve down. Now you could also ice the area at home 10 to 15 minutes on, an hour off, 10 to 15 minutes on. That'll also be a natural anti-inflammatory you can do at home. Sometimes if this condition gets really severe, sometimes they'll inject a cortisone shot around that area to help calm it down. What's nice about laser therapy compared to cortisone is it's a very conservative treatment. There's no negative side effects to it, and it feels very good for the patient, and it also gives them that pain relief. And the nice thing is we can also apply it as much or as little as we need. So if someone's dealing with a really acute piriformis syndrome, we can apply it as much, whereas cortisone, you can typically only get up to 3 shots in an area, and then you're limited with that. Whereas the laser, we can do as much or as little as we need. So what we're going to do is we're going to treat out that whole nerve. Sometimes I'll also trace the nerve all the way down the leg to calm that nerve down. It takes anywhere from about 6 to 10 minutes to do the treatment. And then once we calm the nerve down, then we're going to treat the muscle. To loosen up the tight piriformis, we're going to do 2 techniques. One is going to be dry needling technique, and the other one is going to be active release technique. Now the piriformis runs from the greater trochanter, and then it comes and it goes into the posterior part and attaches on the side of the sacrum. And then the nerve goes right underneath it, or sometimes it actually goes right through the muscle. So what we want to do is we want to loosen up that tension in the glute region, right in the piriformis there, and that's going to take the pressure off the nerve, and then all your symptoms down your leg will get better. So dry needling technique is a technique where we apply an acupuncture needle into the muscle to release that tension and to loosen up that trigger point. So what it's going to look like is we're going to find the piriformis, and often it'll be most tender right over the nerve, and we're going to treat that whole area in the piriformis. So we're going to palpate it, and then we're going to insert the needle into the area. And what the patient's going to feel is like a little twitch or a little contraction of the muscle, and that's kind of the release of that knot or that trigger point. And then the patient will also feel a dull achiness in that area. And sometimes if it's very irritated, they may also get that sciatic-like feeling down their leg when we're doing the treatment. This is a very quick but a very effective treatment relieving piriformis syndrome. So again, we're going to treat out that whole area. I may also treat some of the surrounding muscles like the glute and maybe the upper hamstring to relieve some of that pressure along that whole pathway. The second muscular treatment we're going to perform for piriformis syndrome is called active release technique. So with this, we're going to actively put the muscle through a range of motion while I contact and stretch it out. So what active release is going to look like is I'm going to contact the piriformis, and then we're going to start in the shortened position, which is this position. She's going to flex the leg up and then drop her heel down to the ground. And that rotation of her hip is going to help stretch out that piriformis while I press on it. The other nice thing with this technique is we can also kind of release the nerve where it travels underneath the muscle and to help take pressure off of that nerve. A lot of times patients describe this technique as like kind of like hurts good. It feels like you're getting right into the spot where the problem is, and we relieve that pressure on that nerve and it fixes the problem. So dry needling and active release are 2 techniques we use to release the muscle. Now let's go over a couple stretches you can do at home to relieve piriformis syndrome. So if you're lying down in a bed or on the floor, what we're going to do is we're going to bend this leg up if we want to treat the left side. And what we want to do is we want to flex that knee up, and we want to bring the knee to the opposite shoulder. And she's going to bring it up until the point where she feels a good stretch through her glute and piriformis here. And we're going to either go up more towards her face or more towards her side like that, depending on where she feels more of a stretch. We want to hold that for 30 seconds. and then do the other side for 30 seconds. Repeat this 3 or 4 times and this will help stretch that out. The second stretch we want to do is we want to add in a little bit more rotation. So what she's going to do is she's going to flex this leg up, and let's bring up both legs like this, and then what she's going to do is she's going to cross this left leg over, and then if you're close to a wall, ideally what you want to do is you want to put this other leg up against the wall, and she can use her left hand to push her knee in this direction and then pull behind her thigh on this one to give a little bit more stretch. You should feel a very good stretch through the piriformis and the glute region there. And that's a great stretch if you're dealing with piriformis syndrome. And you want to hold that stretch for 30 seconds and then come back and do that 3 or 4 times. The third piriformis stretch we want to do is we want to do it in a seated position. So this is great if you're at work or at home. So what you're going to do is you're going to cross over the leg, and then what she wants to do is she wants to be on the edge of her seat, cross that leg over. She wants to keep her back nice and straight, chest tall, and what she's going to do, she's going to hip hinge, keeping her back nice and straight. And what you're going to do is you're going to feel a really good stretch deep in the piriformis, and this is going to help to take pressure off of the nerve. You want to hold that for 30 seconds and then relax and then do it again for 30 seconds. Now this stretch, I recommend you do it on both sides. This is a great hip stretch when you're at work and you're sitting for a long period of time. This will help to open up the hips and help take the pressure off the nerve. So if you're dealing with piriformis syndrome, give our office a call at 703-912-7822 or schedule online at novacarewellness.com.